Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A study published in the British medical journal's Gut reviewed all the relevant studies published in English and French in recent years, examining the link between diet, lifestyle, and colon cancer. You know, it's widely accepted that the development of colon cancer, the second leading cause of cancer death in most developed countries, is strongly influenced by dietary and lifestyle factors. Now, in this analysis, certain dietary factors were shown to be protective against colon cancer, and certain dietary factors were shown to encourage the development of colon cancer. So regarding protection against colon cancer, magnesium intake of at least 225 milligrams per day was associated with a 23% lower risk compared with the lowest intake of magnesium. And high intake of the B vitamin folic acid was associated with a 12 to 15% lower risk. So magnesium and folic acid showing evidence of being protective against colon cancer. Also, eating dairy products or consuming dairy products was associated with a 13 to 19% lower risk of the disease as well. And this is probably due to the high levels of calcium that's in dairy products. We've seen a lot of evidence over the years that more calcium helps to protect against colon cancer development. Fiber intake was also associated with a lower risk. It was associated with a 22 to 43% lower risk of colorectal cancer, while fruit and vegetable intake alone was associated with up to a 52% lower risk, with added benefit for every additional 3.5 ounces or 100 grams of fruit and vegetable intake. So in other words, for every 3.5 ounces of fruit and vegetables you consume on average each day, there's an added protective effect against colorectal cancer. Also, the consumption of soybeans and soy products of all kinds was associated with an 8 to 15% decrease in colon cancer risk. Now, factors that increase the risk of colon cancer included red meat and processed meats, which were associated with a 12 to 21% increased risk of colon cancer. In fact, a 10 to 30% increased risk of colon cancer was seen for each additional 3.5 ounces of red meat consumed. So it was a dose-dependent effect. The more red meat a person consumes, the greater tends to be the risk of developing colon cancer over their lifetime. The same appears to be true for alcohol consumption. The more you consume, the greater the risk. This was true even for individuals having only 1 to 2 drinks per day. So overall, most of the findings from this extensive review of the literature are consistent with the studies I've seen published and I've been reporting on over the past 20 years or so. So this analysis is a good summary and a good reminder of how important our dietary practices are in helping to prevent the second leading cause of cancer death, colorectal cancer. Of course, early detection via colonoscopy and fecal occult blood analysis are vital steps to catch colon cancer and premalignant tumors before they reach a life-threatening stage. But proactive, wellness-oriented individuals should also be very keen about aggressively applying dietary and lifestyle practices that prevent the development of colon polyps and malignant colon tumors in the very first place. So the study I'm reporting on today gives us a bit more insight into how we can fine-tune our colon cancer prevention strategy in this regard. So I've included the reference for this information in the text below. Thanks for watching, and I'll see you next time.